raise them up. Wash my hands. Set them in semi-fowlers. Oh, creaky bit. And what am I gonna do first?
Respiratory assessment.
I'm looking at him, right? I'm doing my respiratory assessment. I'm looking to see, is he breathing okay? Is his pattern labored, unlabored? I'm gonna listen to lung sounds, right? If I need to, I would have another nurse. A lot of times you bring another nurse in with you for this, just because if you're gonna be turning him, if I need to turn him to listen to lung sounds on the back, if I turn him away from me, I can't see his trach, right? So you'd have another nurse in there with you, roll him to that side. She's watching that trach to make sure it doesn't come out, right? So I do my respiratory assessment. I had regular gloves on, did all that, listened, looking at him. Okay, so Mr. Jones, I'm gonna change your trach inner cannula and do some trach care for you, okay?
Mm-hmm.
He says yes, I'll be lovely. All right, so.
Do you want me to list these for you? Or
yeah, we just looked at your critical elements and it doesn't say sterile. So we're going to do it non-sterilely, but we're gonna keep this hand clean while we do it, okay?
So number 1 is gather your equipment. Number 2 is position your patient properly and assess for need of suctioning.
Okay. He doesn't need suctioning, we're just doing trach care.
Suction prior procedure if necessary. Then the next one is remove suction device and oxygen source from the trach.
Okay, so if you had the collar on, a trach, you know, you've seen the oxygen or you've seen the collars with the oxygen source. So that would be on right now. We would,
The one that Sarah is getting?
yeah, let's say he had this on. Sometimes you'll see this. Sometimes it's like a big blue tube.
Dang.
It's really long. So if we come in and he's got oxygen on like this, we're just gonna let him sit there for a minute until I get everything set up. So I have my trach care kit, my inner cannula that matches the size of his trach, and new trach ties. Okay. Oh, and some can you grab me some saline? So this just has regular gloves in it, so we'll do it with this. And we'll pour some saline in there. And we'll get my gloves on. Small. So he does not need suctioning right now, so I'm gonna get rid of that. You can put your drape on him. Okay. And then I'm going to, first thing, change the inner cannula. So with this hand, I'm gonna take off the oxygen source and I'm gonna hold this faceplate down, right? You can do it like this, just so you have a firm grip on it. Come in with this hand, pinch these wings and come straight out. Get rid of it. Pick up your new inner cannula just by touching the end here. We don't touch the part that's going in. Start on the side and circular way in. Push it in until you hear, it's not this hard on a human. You sure this was a 6? And it has not clicked, but it will click. There, okay, so now it's clicked, okay? So you have to kind of spread those wings out. So now that's in, I'm good, right? So now I'm gonna go ahead and take out the dressing.
Reattach.
If he needs oxygen, I'll put the oxygen back on. And right now I'm just pulling this gunky dressing out. So now what's next?
Remove dressing, clean tracheostoma area and faceplate.
Okay, so we have Q-tips. These kits have Q-tips in there. So I'm gonna dip it in there. And I'm gonna hold it, but I'm gonna peel it up a little bit so I can see the stoma. And you're gonna go in and you're gonna clean around the stoma site on the bottom. We'll pretend we have more Q-tips. On the top, underneath the faceplate. And we're gonna get another Q-tip. And we're gonna clean the outer part of the faceplate on one side, get another Q-tip and the other side. Because this gets gunky, right?
Does it matter the motion you're cleaning it? Like
no, I mean, you want to make sure you're
around,
under,
up and down.
top and bottom, and then one side and then the other side. Okay.
So bottom, top, and then
You're going to need to be underneath,
the top.
and you can do underneath one side, underneath the other side, as long as you're getting it all. I usually do like top and then bottom.
So it doesn't really matter the order.
Doesn't matter the order as long as you clean. Usually it's easier to clean under first and then you, because if anything comes out, it's going to be on the top of the faceplate. So clean under first and then get up on the top and clean it. Okay?
And change, Velcro ties.
Okay, so now we have these handy, they used to be these old fashioned like shoelaces, right? And you'd have to tie them yourself, they were a pain. Now we have these fancy Velcro ties. Okay.
Those are a little different.
Yeah, they are. I don't like these either. Okay, so when you're changing ties, you want to leave, remember we said leave the old one on first? So you can loosen these ties. Okay. Okay, so you get it loosened. You're going to put your new one in. You have to go underneath the faceplate. Okay. Get your new one in. A trick with this is take out the pillow so that you can get in under their neck. Okay, you're going to come in the other side too and get your trach tie underneath there. I'm going to tighten this a little bit. Then we can take our old one out. Okay, and then we can secure this how tight we want it. How tight do we want it?
So it fits snugly.
Two
You want to be able
fingers.
to get 2 fingers underneath it. You don't want it so tight that it's choking them, right? Okay, so that's done. Now I'm going to take my new dressing, and they're the split ties. Okay, like we've used before on things, right? This is probably the hardest part. You're going to get either a pipe cleaner, and you're going to get one side, and you're going to use a pipe cleaner or a Q-tip to get it up under there. That doesn't work. Use Q-tip. We want it to be nice and neat, and it's kind of hard to do. So once you get it up there, you can spread it out so it's nice and square. Okay, so that's a nice new dressing, okay? And that's what we're gonna monitor. So that is basically trach care. I'm going to put the oxygen source back on. I've got him on a pulse ox, so I'm still monitoring that. I'm gonna listen to his lungs again. If he needs to be suctioned, we suction. And then we come back and do our rounds, okay? So this is PRN at least once a shift. Okay, change the inner cannula and then go from there. It's the hardest thing is practicing getting those ties on and getting the dressing underneath. And remembering to only touch. So when you pull this out, this is a dirty one. When you pull this out, when you have your new one in the kit, you're only gonna grab the end here. Okay?
Okay.
And we're gonna go in the side, down,
Click.
and click. Okay? Questions? Nope.
Nope.
Questions? Okay, so we're gonna be testing inline suctioning today.